welcome to this webinar looking at the current and future challenges and opportunities in Indigenous health and medical research. I'd like to start by acknowledging and paying respects to the traditional owners. I'm on Ngiare in Western Australia. The Academy also acknowledges and pays respects to the traditional owners and the elders past, present and emerging of all the lands on which we operate, live and work. We acknowledge that Aboriginal and Torres Strait Islanders have occupied and cared for this land for over 65,000 years. Thank Pearl, Fiona Stanley, Mudich Kulai. Hello, I'm a happy grandmother. Also a fellow of the Australian Academy of Science and patron of the Telethon Kids Institute. I'm delighted to be with you during NAIDOC Week on Healing Country to provide a platform for Indigenous scientists and knowledge to be shared. This is an important objective of the Academy's Reconciliation Action Plan, so we're pleased to follow on from last year's events to continue these vital conversations. Joining me for the discussion this evening, please welcome Professor James Wolfe, an infectious disease epidemiologist and a national leader in Aboriginal and Torres Strait Islander research with over 130 publications. He's a Pichichinjara Ngakuna man and the director of the Post Centre for Indigenous Health and professor within the School of Public Health at the University of Queensland. And Professor Ngiare Brown, a Yuin Nation woman from the south coast of New South Wales, trained in medicine and public health. In fact, we trained together many years ago on an NHMRC capacity building grant. She's worked at the United Nations on the rights of Indigenous peoples, was head of the National Aboriginal Community Controlled Health Organisation, NACCHO, founding director of Ngiare, a not-for-profit dedicated to Aboriginal child and adolescent wellbeing, and a commissioner of the National Mental Health Commission, and has just opened a clinic about which we'll be talking later. I want to start by telling you about the outstanding result of the First Nations response to the pandemic. We had anticipated, due to the risks and the percent of the population, that there would be about 1,000 cases of COVID in the First Nations population. We had 150 cases, six-fold less than the non-Indigenous population. We had 15% hospital admissions. We had one person in intensive care, no deaths and no cases in remote communities, and no cases after the Black Lives Matter marches. It's the most outstanding Indigenous response in the world. And I want to quote from a young researcher at Melbourne University's Post Centre, Pip Phelan. Indigenous Australia has been spared the impact of COVID seen elsewhere because behind every major decision, strategy, approach and public health deployment, we have seen culturally centred leadership from Aboriginal and Torres Strait Islander people. The lessons extracted from COVID-19 have no doubt been numerous and cover a range of knowledges, spheres and disciplines. But the one lesson that I hope non-Indigenous Australia finally learns is that Indigenous leadership, when left to genuinely flourish without the ever-present interference and paternalism, is phenomenally powerful, deeply impactful and highly successful, highlighting the ways of knowing, doing and being that exist in Indigenous Australia. And this is a very inspirational segue into asking both Ngiare and James to comment on this. Ngiare, let's start with you. Can't hear you. Yes, James, why don't we go to you and then back to Ngiare when you get the mute sorted out.
Thanks very much, Fiona. Let me begin also by acknowledging country where I sit tonight. I'm on the lands of the Ngiare and Turrbal people, and acknowledge that it's NAIDOC Week this week, our week of celebration for our peoples. Fiona, it is very correct that we've had a near perfect pandemic response in Aboriginal communities. 18 months into the pandemic, we still have a perfect pandemic response. As Pip Phelan's work has suggested, Indigenous leadership at all levels and at all stages through the pandemic has led us into the place where we are today. It's also fair to say that the national leadership, particularly the communicable disease leadership in this country, has also steered us in the right direction. But also how we set up this pandemic and our pandemic governance in Aboriginal communities has really worked out amazingly well. Our partnership has been incredible with government and with the community controlled sector throughout all phases of the pandemic, continues today with vaccine rollout. And we've had incredible leadership from all corners of this country that have provided insight to the unique issues such as lockdowns, such as available testing in remote communities, RFDS availability for our communities, all been addressed, all been documented, and all acted on in a very swift manner as we went throughout the pandemic. We still have a long way to go with the vaccine rollout for our populations, particularly when you compare it with other Indigenous populations globally, who, as some of you may know, were decimated by the COVID-19 pandemic. Places like the Navajo Nation and Blackfeet Reservation in Montana and Navajo in the southwest of the US were basically lost many of their community members throughout the pandemic. Those places now give us hope that we can do this in Indigenous Australia and lead the way out for all the rest of our country.
James, what kind of
places like Montana and
James, what kind of
so places like
future way of working?
I mean, places like Montana and Navajo have achieved coverage rates of 80%, 90% in their communities. And this is really at the heart of communities and self-determination and the way that we need to move forward as a country in enabling Indigenous voices, Indigenous science, Indigenous people's input at the highest level in this country to enact the major, long-standing, unacceptable challenges that exist in Indigenous health in Australia.
James, what has it meant for your research in particular, the epidemiology and prevention of infectious diseases? Can you give us some aspect of how COVID has particularly helped or hindered in those areas?
Sure. So what COVID has taught me really is that, besides the epidemiology and about pandemic response, acting early is the right thing to do. It's paramount. Having the right players around the table and at the highest level is paramount. But what has made me do more about our research efforts in this space is that we need to make space to enable good Indigenous science and knowledge. And good Indigenous science and knowledge, if I can just reflect on that, is about enabling Indigenous intellect, sophistication, collaboration, and determination. Without those things, we won't yield positive results from our research. We need to integrate Indigenous science much better with Western science methods, enabling the best of both worldviews, integrating these within our research practice, and enabling much better outcomes for our communities. And single approaches, I've realised, to addressing burden of the disease that exists in many of our communities is not sufficient. Even though often our research agencies call for single interventions and fund single interventions, they are not enough to address the burden of disease. These trials don't take often account of the upstream and downstream factors that exist in our communities or have any impact on the burden of disease. So we really need to reimagine how we move forward with our research allocation and funding and our way that we put a lens on research in Aboriginal and Torres Strait Islander communities into the future.
So, can I now get tonight and get your sense about what this has meant for you in your area, particularly the area of mental health of young people?
Thanks, Fiona. A friend is happy to see you, and I pay my respects to each of you and to those that have joined us this evening. And I do apologise for my tech snafu. That's just the nature of me. Can I just wind back just a little bit, if I may, to the first question you asked about the Aboriginal and Torres Strait Islander response. And it was great to hear from James, because I know that he was intimately involved with the Indigenous National Health Leadership Group that worked at the very, the cusp of, the COVID pandemic here in Australia, and the preemptive work of our Aboriginal and Torres Strait Islander peak bodies, so health, research, allied health, social justice, for example, from our national peaks and NACCHO to our jurisdictional representative bodies right through to our local agencies and service providers. They were able to move very quickly based on decades of primary care work and a national network of over 140 services to help communities create the capacity and the space to focus on how they would keep our most vulnerable well. And given our high burden, chronic conditions, mental health issues, infectious diseases, morbidity, mortality, their work to quarantine communities, make decisions based on local need, boost other public health initiatives. It was actually quite extraordinary and a direct expression of self-determination and our ability to be able to make decisions that affect us based on our own priorities and our own needs. And so that was extraordinary. Not only have we done well compared to the non-Indigenous population in Australia, but we do a lot of work through the Pacific Region Indigenous Doctors Congress with other Pacific nations and Indigenous peoples from, Taiwan, Aotearoa, Hawaii, mainland, US and Canada. And they have, as James has mentioned, been decimated by the pandemic. So comparatively, we have done extraordinarily well. So the diversion of resources in a crisis, for example, our public health response, our health leadership advice to politicians and policymakers has made a difference. And I think from that perspective alone, there's a lot that the mainstream systems and services can learn from those efforts. So there's that. Certainly from the work that I'm privileged to do, so with Munchkins in particular, I do outreach work and I have a clinic in Wollongong. So the social and emotional well-being aspects of that, the mental health impacts. So, last year in particular, we know for adolescents, say, they're struggling anyway with transition periods, with social growth, with, emotional, physiological transitions. They were increasingly isolated and they really did struggle. So there was that cohort of Munchkins that found it really hard. The homeschooling had a bit of novelty to it in the first instance, but then it kind of dragged because they didn't have the opportunity to socialise in the same way that they really did need and they craved. So they struggled, and I'm seeing a lot of young people around that. There was another cohort. So for them, their day-to-day normal is isolation, social, cultural, geographical. So for them, it was perhaps just another day. And so, but we've been asking the questions then around our work, can some of our kids be too resilient? Because I tended to just to brush that off as if it was another day. So, from that perspective, it's been quite interesting. But certainly the work that we're doing around clinical service intervention and our research foundations are very much in response to community requests to help them identify, assess, and then respond, to translate, and then to implement and create impact around their priority issues for child and adolescent social and emotional and cultural well-being.
I come in now with will the impact of the success of the pandemic by our First Nations scholars and leaders influence the way that Indigenous research is appreciated and funded? And will there be enough vision, the kinds of things that Bill Gates might have, the grand challenges? Now, perhaps you could comment first and then James, but isn't this the best opportunity now to convince Australia that giving the power to Aboriginal people to do the research they want to do is going to make the biggest difference?
Yeah, I would certainly agree. So, you know, I'm old and crusty, and we've been doing this for about 100 years now, right? So we tend to find that with the major national funders, often in Aboriginal funding, influence and leadership in research, it's 2 steps forward and 1, 2, 3 steps backwards. However, we continually demonstrate that the way in which we approach every aspect of research, from engagement and priority setting right through to then how we conduct the research, support and build local capacity in research, extraordinarily important. You have to leave behind what you bring to the table, for example, then to translation, implementation, you know, resource allocation and service delivery, so that we are creating impact through research. What we do can actually enrich the entire profession. So there's that. I think James alluded to the fact that we tend to approach research resourcing in bite-sized or piecemeal aliquots, right? Such that, you know, if we're able to play the long game, which we can, and to plan ahead, which we can, you know, we then look to, well, you know, it's such an enormous, you know, there are enormous pieces of work for which we want lifetimes worth of impacts, and a 3-year funding round ain't going to do it. So how do, you know, we've learnt to work around phasing or staging research, and to be able to support and maintain relationships over time. Why can't we then have national networks and research hubs as they have had in Canada, for example? Why can't we look to this more as an investment rather than a spend in research funding, like grand challenges, like the Gates Foundation and other major philanthropic funders do, and actually release us to be visionary, to be imaginative, to be able to reach and extend, you know, the impact of our work. And I can guarantee you that we have the talent and the potential to be able to do so.
Fantastic. James, you were talking yesterday about the wicked problems. This is really what Ngiare is talking about. This really interactive and immensely complicated situations for First Nations, and the kind of sophisticated Indigenous approaches that are going to solve them. Have you got anything more to add on to that? In terms of what it means for the funding, assessment of your research and its funding?
Yeah, absolutely. Like, essentially, we are solving wicked problems here in Australia with our population. Many of the infectious diseases, communicable diseases that we're working with, chronic diseases that we're working with, are wicked problems. There's been a whole lot of people who've invested a lot of time and effort into research, and still we are not shifting the burden of disease sufficiently enough to impact our communities. So I think what we need to do is reimagine the way we conduct research, the way we fund research, the way we allocate research dollars, to ensuring that we have impact. And impact is becoming a greater metric of organisations like NHMRC and ARC. But essentially we're doing a lot of research that contributes to the evidence base, but really doesn't shift the burden of disease. And so I think reimagining the research framework or the ecosystem very differently for Indigenous communities here in Australia will serve us well. And by that, I mean, we really need to think about beyond single interventions. We probably need to think more about the synergy of interventions together, things that have worked individually in the past, bringing them together, making our research transdisciplinary, making it longer term, because actually 5 years is not such a great long time, especially when you spend a year or a year and a half engaging communities. And what that will translate to, I think, is a better understanding of how we can deliver our research, the potency of our research at the right level, at the right population, for the right length of time. And then I think we'll have a good go at shifting burden of disease in our population. So there's a couple of, there's one example I just want to provide about why we need to shift our ecosystem of research for Aboriginal and Torres Strait Islander communities. I'll highlight sexually transmissible infections, which is an area I work in remote communities. Very high prevalence in a lot of communities in remote Australia, particularly, for a very long time, and yet we haven't been able to shift prevalence in those communities. HIV in non-Indigenous gay white men, predominantly in the city, very different populations, probably the most marginalised population, young Aboriginal people that live in remote communities, compared to a very enabled population of gay white men that live in city predominantly. They're both allocated the same number of grants, roughly, both allocated the same amount of money, but actually one doesn't have the major social determinants or other determinants that are impacting compared to the other one. And that is where we need to really have transformational change in the way we think about research. As a simple example, and it's not judging any of those two populations. I work across both of those populations, but in equitable terms, we have a whole lot of other determinants that play out with the Aboriginal and Torres Strait Islander population, including the way history has rolled out for our population, and including the way that research has been rolled out in communities that sometimes hinder our progress in rolling out research. So there's a whole lot of other determinants that impact on Indigenous communities that I think is not taken into account when we're working and allocating and working in Indigenous research, as well as what Ngiare touched on before, which is really about the capacity to be able to deliver this kind of research in our population. So really putting Aboriginal people in the front seat, putting extra attention. Today I saw Pacifica and Maori made a major change in the way they deliver research in New Zealand, 2.5 times for Maori research and 2 times the amount for Pacifica research, recognising the underrepresentation of Pacifica and Maori researchers in New Zealand. So really significant, and hopefully we'll move that way very soon in Australia.
And perhaps the Academy might be able to make some statement following this webinar. But this leads me to the question, James, about the ways in which research and your research activities have changed now since the pandemic, but also to touch on what you just said about community-led research. Why is it important? And has that changed since the pandemic because it's been so powerful? What about the power of the elders? What about community? What about the sophistication that you bring because of these complex, interactive, wicked problems?
Yeah, absolutely. So the downside to the pandemic on our research is certainly slowed down our research over the last year or so, and it's slowed down everybody's research. One of the really negative things I feel for us as Indigenous peoples, for me and for a lot of Aboriginal, Torres Strait Islander people, everyone, is that the power of the body language is missing from pandemic. We're using these virtual networks. There's nothing like being on community, in community, across the table, around a tree, out bush, with our own mob to pick up body language. That's more than 90% of our interpretation of what we get. We don't get this on Zooms. So that's one of the downsides of the pandemic for me in terms of rolling out research programs in our communities. But the other side to it, there are many spin-offs from the pandemic, and not that we want these, not that we want the pandemic in the first place, but there are many spin-offs from the pandemic. And in my view, I feel like Indigenous communities have finally seen a very positive result as a result of their involvement. And that rarely comes, and it rarely comes in the area I work in, which is communicable disease. but they have seen a massive result for our communities. And I have absolute confidence that if we have the vaccine supplied to our communities, we will lead Australia out of the pandemic with vaccines. Our elders, our communities, our leadership at all levels across this country have led our communities to a very safe outcome with the pandemic. I'll never forget the day I woke up on a Sunday morning and one of the major land councils, the Northern Land Council in the Northern Territory, had translated what COVID is into 18 community languages overnight, basically off the back of their own agenda, and they had really wanted to get the message out. It was incredible work. The Aboriginal medical services have led amazing responses in triaging patients, ensuring that people have access to testing, ensuring communities know what COVID is and how to prevent it, enabling quarantine and isolation facilities if there was to be an outbreak in communities. The amount of work has been phenomenal.
I think, James, just to interrupt you there, our non-Indigenous population could have learned a huge amount about health literacy and health promotion from the incredible response to the pandemic. Mary, back to you. The theme of NAIDOC Week is Heal Country. It's about identity and culture and values and respect as much as about protecting lands, water and sacred sites. But how will healing country improve the health and well-being of Indigenous Australians?
So, and I will get to that part, but I wanted to just reflect on the comments that James has made, and I think we continue to do a disservice in the research community by underestimating Indigenous research leadership. I think that we have never asked for a lesser standard of research practice. We have just asked that we enable, support and empower us to be able to look at research through a more appropriate, relevant and contextualised lens. And in fact, it then enriches how we are able to conduct the work, translate that and implement that. So there's that. You mentioned sophistication. So, I have to, my caveat is that in fact I'm still wearing my pajamas, right? But our communities brim with a sophistication that we don't ordinarily recognise. And just as an example of that, doing some remote work, and it was genomic research with some of the remote communities in the Northern Territory for this particular project. We are involved with others. But here was I, somebody who's, mainstream educated, supposed to be a little bit clever, not a lot, I don't claim to be, but I kind of clumsily sort of tripped my way through an explanation of, genetics and genomics and environment and DNA, and I'm twisting rubber bands and using Lego blocks. And all the while, these beautiful senior community members sat quietly up the back, smiling and nodding. And when I'd finally kind of, come to the end of that flustered explanation, they smiled and nodded. And they said, well, that reminds us of the story of the cycad palm. I went, oh, and the cycad is used for medicinal purposes, for ceremony, and has a very, very strong cultural importance. And basically the moral of the story is that dependent upon where you plant the seed, within it has every ingredient to grow a strong, healthy plant that will live a long life. So it just depends on where you plant it and how you nurture it and the environment that you provide it. So with that one story that they passed on from generation to generation, they encapsulated the notion of, genomic and transgenerational transmission of, characteristics. So there's that. The notion then that, we talk about the social determinants of health and the impacts of education and employment and your economic stability on your health and wellbeing outcomes. I think that they come from a very punitive or negative base, if that makes sense. And so what we've been talking about for quite some time now is, the cultural determinants of health and how they're strength-based, and how we take the notion then of our connection to country, our protections of waterways, revitalisation of language, access to lands, connection to one another and the understanding of story, narrative, performance. All of those, we have a growing evidence base now that demonstrates that where we are able to maintain or revitalise our traditional practices, everything from place names to education in schools that actually share the story and the history and the truth of Aboriginal participation in modern day Australia, we actually are able to then minimise, diminish and positively impact outcomes around mental health, around physical well-being and all the metrics and parameters that we can tangibly measure. Everything from brain growth and development to emotional stability and well-being to educational and academic attainment to stable economic purpose and participation. So it's all there. And we know that it's intuitive, but then how we share that and maintain that through the research community, I think, is extraordinarily important.
I think that's very important from the point of view too of diversionary programs before children go into detention. Going out on country with elders is shown to be the most effective way to handle those young people. What happens, of course, Ngiare, when the land is damaged? We talked yesterday about the Rio Tinto bombing of the Juukan Caves and the fact that it wasn't just the local people who were hurt. I think, James, you mentioned everyone in Australia was hurt by that. So I don't want to be negative. I think the positive things that Ngiare has said about healing of country and mental health are just fantastic. But James, do you want to just elaborate on that quickly before we move on?
Yeah. I mean, this week talks to me about the connection of country to our health status. There's no place for me than walking, listening and sleeping in the desert of Central Australia, where our ancestral roots are. I imagine always our history there prior to colonisation, our ancestors. It was this week last year that the destruction of the Juukan Gorge Caves occurred. And I think it'd be fair to say that when any of these significant sites are destroyed, even if they're not our country, we all feel the pain. So when one people lose something, we all lose in that. And so this is the power of the earth to our people. It's the power of our country. And this week is a reminder that we have to do much better in protecting Mother Earth, the land, the hills, the waterways, and the stories that are connected to those for our future generations. And it's a really powerful thing this week.
And James, this now seems to be, people are now very keen to find out about the Aboriginal ways of managing the land in terms of not just fire, but all of the others to preserve the future of our country. But that goes on to now ask you and to ask Ngiare about the racism that we can't ignore, that Indigenous Australians experience, and particularly within the healthcare system. What role can researchers in the science sector play in rectifying this? What message should we be giving out to members of the Academy who are listening in tonight about what all of us can do to address this issue of racism? Could research help here? Can science help here? Could you please comment, Ngiare or James to start? Okay, Ngiare.
Ngiare?
Dive in then. So, you're absolutely right, Hannah. And we know, again, there's tangible evidence that, in fact, individual systematic and institutionalised racism and discrimination and exclusion actually account for differential outcomes in health and wellbeing, morbidity and mortality, particularly for Indigenous peoples and other peoples of colour here and, globally. Such that, when you control for every other bias, be it geography, technology, presentation times, it comes down to individual decisions based on race as to who gets what treatment and at what time and their particular illness or presentation. So I think, for an extraordinary organisation like the Academy of Science, the notion that you have to lead by example, that you don't and James has some fantastic thoughts around this, but it's not just about, not tolerating exclusion, discrimination and racism. It's about eliminating it from our environments. It's about being vocal and responding. Can I just say, and this is a bit tangential, but bear with me, as a clinician, for example, and we have to all come up through the ranks, the power differential, the power imbalances in all of our environments, whether we're medical students or labbies or clinicians in a hospital setting, we need to address that, such that behaviours that perpetuate, racist platforms, comments, leadership in what is an extraordinarily important environment should not be tolerated. And so how do we then phase that out? And leadership, I think, is one of the key pillars of that change.
Yes, especially the leadership we just had demonstrated during the pandemic. So, James, can you add to that? And then I've got a whole lot of questions coming in that I guess we have to address. But one
I don't really have much more to add, Fiona, really, just to be aware of it, and really I don't think it's really been quantified very well in the healthcare system and the research sector.
Yes.
But I'm very conscious that it's probably aware there, and we probably need to do better to understand where we're at, and then enact the strategies that Ngiare has already
well, perhaps we could get all the learned academies together, as they've done in the States, to look at racism and in Australia, and what might be done in terms of the research and science sector about that. So that could be something we might suggest. Now, I've got some questions that I'd like to put to you. Donnie Kennedy is asking, how can we make Indigenous research paramount? So all the things you've been saying tonight is that we want to really make a difference to the way research gets funded, big vision research. How do we do that? How can we do that? I could well ask the Academy, how do we do that? But I'm asking you two. Are there ways in which we can do this?
I'll dive in just really quickly. So there's some really simple, moves that we can make. And some of it's going back to the future, right? So I know, for example, with the NHMRC, we had the capacity building grants, right, Fiona? Which actually, it was a national initiative looking to identify and grow Aboriginal and Torres Strait Islander researchers, everything from research assistants in labs through to docs that wanted to, create a research profile and career over time. And they were phased out.
Because the impact of that capacity building grant has resulted in probably about 30 now the postdoctoral scholars in Aboriginal health and wellbeing across the nation, most of whom are now leading their own research teams and projects, because you got trained in this and then you recruited more people, and so it went on. And it starts to answer Sabina Belli's question to you, Jane. Is there enough capacity in the Indigenous research space in Australia? Do we have enough people to work? I'm getting very excited about the incredible number of young Aboriginal researchers that I'm mentoring. I mean, they're brilliant. But do we need to have more capacity building grants, James? Do we need to have people now, both ARC and NHMRC and other organisations supporting more Aboriginal researchers and their career paths?
Absolutely, yeah. Absolutely. So I will allude to the NHMRC's recent announcement of a $10 million grant to build or to address the underrepresentation of Aboriginal and Torres Strait Islander researchers nationally, being led by four very influential scholars in our country, the Lowitja Institute, Janine Mohammed, Professor Sandra Eads, Professor Alex Brown, and Professor Gail Garvey. An incredible opportunity to build capacity of our researchers over the next 5 to 7 years. That's one incredible opportunity. The other thing I would say is that it's probably timely that we started to put some more accountability on the research institutions that receive Aboriginal and Torres Strait Islander dollars about their capacity development initiatives. For far too long, I've seen Aboriginal and Torres Strait Islander research grants being allocated without any capacity building measures put forward. The people who do it best are Aboriginal and Torres Strait Islander people, because we know how desperate we are to build a succession planning pathway for us who want to retire in a decade or so. I'm so desperate to get Aboriginal and Torres Strait Islander junior researchers coming through the ranks. It's unbelievable. But I think we do need to put some more accountability measures around people who receive grants and probably don't do the things they might say in their applications.
So in fact, what you might do is say that you won't get the money unless you have a very clear program of how you're going to build capacity. I'm not joking, James. Talking about accountability, I think that's a really, really important suggestion. We've also got another question here about the role of technology in the health of Aboriginal communities, which I think is quite an interesting one. So who wants to take that question?
Look, the more we can, for me, the more we can embrace technology, the better off we'll be into the future. I think there are some things that we absolutely need Indigenous science and Indigenous knowledge and Indigenous ways of doing. We absolutely need that, but we need to integrate it with technology. And for me, strategies like the use of genomics, the strategies around big data, the strategies around other interventions that are rolled out that make it easier for our research to be conducted, I think absolutely need to be there at the interface with Indigenous knowledge. Without that, we're going to be left behind. And so I think we absolutely have to embrace it, but we have to put the right frameworks around the use of these technologies so people are not exploited. Beyond ethics, this is really putting major frameworks around it. The use of biobanks and the use of genomics, Ngiare might be able to talk to better. But really, we absolutely need to use it. Everyone else is using it. Why should we be left behind? And we absolutely need to embrace it.
Yes, I'd like to ask Ngiare about this, but also what I'm impressed with the groups that I'm still working with is that even with the most technological aspects, the elders' wisdom is extraordinary. And Ngaire's already referred to that. And the kind of things that they've talked about in terms of our data linkage projects and so on have really been incredibly important. So that I love this idea of involving the community, how empowering that is for the research, but also how it feeds the self-esteem of the whole community, which then impacts on mental health and suicides and all the things that Ngiare was talking about before. So now, have you got any more questions to answer about that technology, but also how can all Australians contribute to improving Indigenous health, empowering communities and healing country? As a next question.
That's just a single question, is it?
Two questions.
My lovely, if I had the answer to that question, I would be a wealthy little brown girl. But I mean, very simple, and given that I work with munchkins, right, for me, how we create change, there is no single starting point, but for each of us, there will be an area that really is, our passion and where we function. And so I believe that a foundation in education in the curriculum at national level, as well as state and territory, and the other jurisdictions, independent, Catholic, whatever, public schools, it's not about black armband or bleeding heart, it's about a statement of truth. And until we are able to speak the truth, discuss the truth, accept the truth, and people will find it really difficult to move forward. We just, at the very baseline, we just want that acknowledged. And if every child was able to learn about their local Aboriginal groups and languages and songs and performance, we're not born racists. It's a taught characteristic. And we can address that, and to a great degree, I believe we can eliminate that. So that's one, it's not as extraordinarily difficult a step as you would think. And there are multiple exemplars of how communities and schools are implementing components of STEM or STEAM. So we do some STEAM stuff in the schools where I work: science, tech, English literacy, arts and culture, and maths. And kids love it, but there's an Indigenous spin on that. So we use all of the foundational basics of Indigenous science to teach STEM and STEAM stuff. Kids dig it. So there's that. They're really simple movements that we can actually all do as individuals, as clinicians, researchers, parents. So there's that. And I think then the spheres of influence, and the ripples on a pond when you drop a pebble, the influence that you then have within your own sphere, never underestimate how impactful and how powerful that is. So if your attitude, your speech and your actions are right, the influence you have on others may be subtle, you might not see it at first, but it will then grow, and that will spread to the next ripple and the next. So, your behaviours, I think, will make an enormous difference.
That's a very good lesson for the Academy, and I salute them for doing the kinds of reconciliation action planning that they are, and the NAIDOC activities that they are, and the other things they're doing in terms of Aboriginal knowledge outside of health, actually. James, have you got anything to add? I noticed that none of us have specifically mentioned the Uluru Statement from the Heart, which is about, of course, a voice enshrined in the Constitution, truth-telling and talking towards the Makarata. But really, this is what we're all been talking about in a way, that if you give power to Aboriginal people, and boy, have we had this wonderful story of the power that was given to Aboriginal people during the pandemic, translated now into an example from both of you, the sophisticated science and knowledge that Aboriginal people have, which is much more understanding of really the social determinants of health, the cultural determinants, and the land determinants of health and well-being. We have so much to learn, I think, if we are participants in this Uluru Statement as well. Have you got a quick answer to that? We've got about 10 minutes left, I think.
Oh yeah, just very quickly. Our people have spoken. They've formulated the Uluru policy statement from the heart. We need to enact it. We need to address the injustices, the truth in this country. And for Australians to get involved, I think the first thing they need to do is get informed, read the Uluru Statement from the heart, support every aspect of it, sign on to the support, and activate and participate where they feel comfortable to do so. Reach out to Aboriginal and Torres Strait Islander people where you feel you can make a contribution, but don't sit there in hesitancy. We absolutely would welcome the right people to come and help us.
Thank you. Ngiare, do you want to? I've got another question, but do you want to just touch on the Uluru Statement?
Yeah, sure, hun. So, the beauty of the statement is that it is a reflection of the will and the desire of, people from right across the country. And so it should be shown its due respect. So there's that. And, just on the power, Aboriginal and Torres Strait Islander mob, we already have power, but it's about others leaning into the process and enabling us to then be able to lead the conversation, the action, the process, and trust that we know how to contribute in that manner at very high levels. And I think that certainly from a political perspective, there's a lack of trust around our capacity to be able to do that. And quite frankly,
I agree.
If they just, did as I told them, we'd be in a much better space, right? So, so there is that. But every Australian that has an interest, a desire or a passion in this area needs to, lean into the process. And as James said, inform yourself, be informed, read, contact, reach out, be involved. It will be a life-changing experience.
If we did this, it would be economic best practice. You think of the traumatic and expensive and useless interventions from government over years and years and years. I'm thinking of the Northern Territory intervention in 2007, And since then, child sexual abuse in the Northern Territory has gone steadily up. Where's the evaluation of that particularly very, very harmful project? And again, there are examples of useless and many harmful projects that are produced by governments, maybe well-meaning, that have had very, very adverse effects on Aboriginal populations. And as you say, Nai, if only they could have listened to the Aboriginal voices and to actually have implemented those kinds of things, we would be better off. And it is economic best practice, because you won't be wasting the billions of dollars that have been wasted in healthcare, in environmental situations for Aboriginal people. And we haven't even touched on things like housing and all those other things, which are just so very, very important in terms of the social determinant. There's one question from Adam Cross, and I don't know if we're going to have time to address it properly, but it's all about the integrity of the ecosystems in which we live, and to improve health and human livelihoods from keeping those ecosystems healthy, and the ecological restoration that needs to happen in Australia, and the way that in fact we could get, and he mentions the economic opportunity for Indigenous communities to participate in that regeneration by using Indigenous management and stewardship. Now, there's a very exciting lot of Aboriginal scientists that are involved in this. Can you just give sort of a minute each on that, of how that might impact upon our debate today?
I'll go first this time. So really, I think a very strong case for economic and government investment in Indigenous knowledges in caring for our countries. Indigenous rangers are caring for our waterways, the north of Australia, our parks all over the country. Recognition of sovereignty in those places is also critical to this. I think we need a major investment. We shouldn't only be seen as the experts after major disaster, like the bushfires that occurred in 2019. We absolutely have been here for a very long time, 60,000 years, and have cared for this country for a very long time. The knowledges are there. They're not being enabled, and I think it would be a very wise investment, not only for Aboriginal and Torres Strait Islander Australia, but for all Australians.
Thank you. Nai?
You know, I thought that was a great question, and James's response, I agree absolutely that, you know, our knowledge and practice around environmental protection and maintenance isn't just about coal burns or about a response to, you know, post-crisis, or, you know, even, you know, our rangers that are doing extraordinary work in the north around ghost netting, you know, reclamation and trying to tidy up the mess that the rest of us have made with the environment. It's actually about, I don't like the word proactive, but it's actually about sustainable practices around maintenance and protection, which is extraordinarily important. In terms of the return on investment in economic and business development, you know, even if it's around rehabilitation of farmland, of quarries and other mining, you know, post-closure, for example, it's quite extraordinary. So, for example, rather than, you know, during drought, which we tend to have a lot of now, given that not only were we a large sort of, you know, desert island to start with, we've extended the reach of the deserts to the very edges of the continent, such that there's a nice, fine, squiggly green line around, you know, the outline of the mainland, for example. And, you know, I'll just put my cards on the table here, unsustainable and environmentally damaging farming practices and other agricultural practices over time. So rather than just sort of boosting, you know, farming families that haven't been able to diversify or sustain their businesses, then you transition them into other activities and around the rehabilitation of their properties under the leadership of Aboriginal and Torres Strait Islander peoples. And so it's a win-win. It's a win-win for the families, for Aboriginal businesses, for the Australian economy, and we've actually then diversified income streams and the, you know, skills basis, such that people don't rely on a single source of income for themselves and their families over time. And we are actually then rehabilitating the entire continent at the same time.
And now that you've already got data to show that this kind of activity increases the self-esteem of the population, so much so, as we've shown with Canadian data and our own data, that suicides are reduced in young people because they have a belief that in fact they're valued and that their communities are valued and that Aboriginal knowledge is valued, and so they don't feel so unhappy that they take their own lives. It's pretty amazing research, that, and you've done some of that yourself.
You know, I think that it's also a demonstration then of not just a repair of country or a healing of country, but the healing of relationships in areas where the interaction between Aboriginal and non-Aboriginal populations hasn't necessarily been cordial.
Yeah, no, I think that's a really important point to make. I'm going to now quote to you, because we are coming to the end of this incredibly exciting and important webinar or talk that the Academy of Science has put on so well. I'm going to leave you with this quote from Garawa Yunupingu, who's a Yolngu elder who signed the Uluru Statement. What Aboriginal people ask is that the modern world now makes the sacrifices necessary to give us a real future, to relax its grip on us, to let us breathe, to let us be free of the determined control exerted on us to make us like you. And you should take that a step further and recognise us for who we are and not who you want us to be. Let us be who we are, Aboriginal people in a modern world, and be proud of us. Acknowledge that we have survived the worst that the past has thrown at us, and we are here with our songs, our ceremonies, our land, our languages, and our people, our full identity. What a gift this is that we give to you if you choose to accept us in a meaningful way. Just makes me have goosebumps when I read that to you, because really, how could we not accept this wonderful offer from our Indigenous Australians? And I'm afraid that is all we have time for tonight, but I want to thank you, the audience, for joining us and coming in on this debate. We can't see you, but we know you're there. We love you because you're going to go away and talk about this with all of your friends and colleagues. And there may be even some people from other countries that are listening and supporting us here in Australia to get this message out about the excitement of the pandemic science and how that now can translate into a new way, a new world of how we value Aboriginal science and support it and build capacity for it. So the biggest thank you to my dear friends and outstanding scientists, Ngiare Brown and James Ward, for joining us today. You're absolutely outstanding, and I think everyone is truly so grateful to you for giving your time. I'm a retired old woman, I could come at any time, but you have given up a lot of your time to be here and given it us today. We know you're asked a lot to give this stuff. I see you all on the drum enough, and you have to keep on talking to us and be representatives as Australians, Indigenous Australians. So thank you so much for sharing your time and knowledge. And happy NAIDOC week, everybody. So thank you and good night.
Thanks, Fiona.